And so we're grateful to be here. So now that the recording's on, I'd like to welcome everybody. Welcome everybody to our April 26th practitioner event, Practitioner Call. We're so excited. This is the second time that I've had a collaboration with Ricky James, who's an amazing leader. I've got amazing people on this call. Carolyn Dow is an amazing leader. I got Nicole Prophet on here as well, who I haven't met personally, but I'm excited to be on this call with her and have the privilege of working with such amazing heart-centered people. And so today we have a lineup of practitioners that is just phenomenal. And the reason we want these practitioners to be here is so that they can not only tell a little bit about their own story and why they chose to grab hold of this mind-blowing technology, but why they decided to share it and join forces with somebody like me or Ricky James or Carolyn or Melissa Marsden or whoever on this call. And so what we have, ladies and gentlemen, just briefly, is VTT, Vibral Tactile Technology. And what this is, quite simply, is like Braille for the brain. You put this on your skin, you peel it like a Band-Aid, you put it anywhere on your skin, and it sends a message to the brain, and then your brain optimizes to deal with whatever modality you put on. And we have 13 modalities, and we'll talk more about this. So my co-host today is the amazing Ricky James. I'm going to be seeing her this weekend as well in West Palm Beach, as we have an amazing training for our leadership. So I'd like you to say hello, Ricky.
Hi, you guys. I am super excited to be here. And yes, along with Terry, we are just really excited to share with you guys some of our favorite practitioners that have been using this in their practice with so many different clients and seeing like absolutely amazing results. And I'm very honored to introduce our first practitioner this morning. This is Melissa Marsden. So Melissa and I were friends long before Super Patch. And we are very mutual respect there because we are rebels, and she shakes things up and she does things very differently. She was in behavioral therapy for 15 years prior, and for the last 5 years she has been a naturopath doctor. She has her BA, she's a CNP, CBP, a Bachelor of Arts in Social Work, Education, and Behavioral Psychology, and was recently accepted into the PhD program for energy medicine. Melissa is one of my favorite people to be able to hear what she is doing today. I know she's going to touch on how she's been able to impact the neurodivergent community where she lives. It's really incredible. Every time I talk to her, I am pretty much in tears by the end of some of these stories that she's sharing. She has a heart to help others, and I'm super honored to be here with you, Melissa. Are you ready to share with us? Oh, let's see. Can you unmute Melissa? There you go. Yay.
Okay, I am here. Well, thank you so much. It is such a privilege to be here with all of you, and I love talking about Super Patch. It is one of my favorite conversations to have. So yes, one of my passions has always been behavioral therapy. So I love working with neurodivergent children. I have a passion for the brain and neuroscience. So a few years ago, I really started to tap into the concept that everything was neurology. And until we dealt with neurology, we were really never fixing or helping the body. So I have been on that journey for a while with my kids and with my clients. We've been really working on that. So last year, when Super Patch was presented to me, because I understand neuroplasticity and I'm such an advocate for neurology and helping the brain, I could not say no. I dug into it. I looked at it. I tried to find reasons why it wouldn't work. I did all the research. I talked to all the people, and the truth is it is brilliant. And I am so excited to be on this mission to partner with Jay and all of you to bring Super Patch to the world. So today, Ricky and I had a quick conversation, and one of the things that she said I should really share on is kind of my passion around working with kids with some issues of behavior and even just motor skills and those kinds of things. So I've been on this journey to help little ones for a long time, and before Super Patch, I was really focused on using frequency to really build brain function and to help with language and all of that. And one day I'm going to share kind of what led me to bringing even the patches into my practice. It's kind of a random story, but I was sitting, so I had gotten the Kick It patch. We're going to talk about the Kick It patch today, okay? Because it's my favorite and it's the one that has changed my practice forever. So for those of you that don't know, this is the patch that was designed to help break bad habits or to rewire the brain and to help the brain kind of work through those behavioral things maybe. So one day it started with me. I got this patch and I thought, hey, I'm going to try it on. Never used it before. So I was sitting at my sink and I was cutting vegetables, okay? Just cutting vegetables like on a normal day. And I realized I have 5 kids and my house is typically quite busy. And I realized it is so quiet in here. And I thought, what is going on? And so I realized at that moment, it was my own brain. I wasn't thinking about, my clients and paperwork. And I wasn't thinking about getting my kids to bed. And I wasn't thinking about all these things. I was really zoned in. And I thought to myself, oh my goodness, is this the missing piece? And so after that moment for myself, I got on the call with all of my people. And I said, we're going to try this patch. If you have a child or yourself that has a scattered brain, that can't focus, that's all over the place, that, struggling with stimulating behaviors, I have a lot of clients that deal with that. I said, we're going to try this patch on. So I started working one by one with my clients, and I cannot believe the powerful testimonies that I am seeing. We have little ones that were unable to focus in the classroom. This patch has changed their lives and the lives of their families. We have little ones that could not get words out or get focused because they had so much sensory overload all around them that it was impossible for them to stay focused on task. This patch has really opened up opportunities for that. So we are seeing, I can't even express to you the power that I have seen from this patch. And I brought it to Ricky and I said, this is it. This is it. And so I started really playing around with the combination of peace, Kick It, and joy. So that was my 3 that I really started to work with. And I am seeing every day, I'm seeing little ones being able to focus in the classroom. We're seeing stimulating behaviors like flapping of arms and unable to kind of get over repetition or repetitive behavior. We're seeing a lot of that really mellow down. So I'm really excited about it. I know, and now we've brought it into adults because I also work with adults with some behavior stuff that can't focus, that have, nagging repetition in their thoughts. And it's been such a powerful tool. So I believe so strongly in the power of the rewiring of the brain. I know that we are, as humans, have this incredible ability to rewire and to restructure our systems when given the right tools. So I just want all of you to know that if you are new here today or you've never experienced the power of Super Patch, really what we are doing is we're reminding our own technology. We are a technology. Our brain is a technology. And we are really, in essence, rewiring our own system and waking it up and bringing it back to the foundation of what we all inside of us already have. So be encouraged by today's call. It's an honor to be with all of you and the medical people that are using this. I believe that it's the future of medicine. I believe so strongly that it will be everywhere. Every doctor's office, every medical professional will be using it because there's no ingredients. There's no worrying about interacting with medications or, affecting other parts of the systems. It's a way to bring our neurological system into complete homeostasis. So I love everything about it.
Melissa, would you share really quickly too? I love the way that you have also helped some different people navigate through grief. Will you share on that for just a minute before we?
Absolutely. Yes. So with this Kick It patch, it became kind of my passion. So whenever people ask me, what is your favorite patch? I go to Kick It for everything. But one of the things that I do a lot of work with is people that have had sudden grief or lost children. I'm going to share a quick story with you. It's a little bit, it's close to my heart, but I've had 2 specific women in my life that have lost their children very suddenly. And that, of course, causes trauma to the system, right? It's horrifying. And when I first got connected to this technology, it was my first thought, I need to phone these 2 women and we got to get them on the patches. So this was the first patch that I always bring with me is Kick It. I don't go anywhere without it. And we put this patch on both of them, and they were both able to function. They were able to get through their day. They were able to have some different mindsets and thought patterns around what had happened. It doesn't take away the grief, right? And it doesn't numb the body, but what it does is it helps our brain to keep going. Because when we lose loved ones, we can't stop, but we don't want to keep going sometimes, right? So we have been doing a lot of work around this. The joy, kick it, and peace combo has been an absolute life changer for my people. And one of the things now, I have a lot of people that will come to me, even on social media, and they'll say, okay, we have someone that's just lost family members, help. And I mean, it's my little security pack. It's my go-to for people. Put it on. Wear the three of them together. Let your body and your brain rewire. And those negative things, even people that have trauma, you know, that have had some things in their life that they just can't get over, put the Kick It patch on and let your brain rebuild those neurological experiences. Let your brain be able to rewire you, not take away your pain, you know, or your trauma, but help you work through it. Years ago in behavioral therapy, we had to be repetitive, right? Even when you go to counseling, you have to be over and over. You rewire your brain for new experiences. This incredible technology allows our brain to do that while we're navigating life. It's absolutely phenomenal. So I love it. And if you have anyone in your life that is struggling with any of those things, you know, repetitive behaviors or can't get over something, even people that can't sleep at night, sometimes it's not even insomnia because you can't sleep, it's your brain doesn't shut off. And one of the things we've really found is that even that combination is helping with those types of things. So add a Kick It patch to your REM and watch how even that can enhance your sleep.
So amazing. Thank you so much. That is my favorite, some of my favorite stories to listen to ever there. And we're super grateful for you. We appreciate it. Our sweet Caroline, are you up, dear? Are you there?
Hey, I'm here. Hi, guys. Melissa, that was absolutely amazing. Thank you so much for sharing. I know people learn so much. The more, you know, I hear from practitioners like you, and the more we share the information and the technology, the more we can help more and more people. So that was amazing. We really appreciate it. It's my honor actually to introduce the next speaker and doctor. She's a close personal friend of mine. She has a very long resume, so I want to just give it to you in a Cole's Notes version. She is a PhD. She's a medical doctor. She is a doctor of naturopathic medicine and also a renowned expert in bioenergetic restorative medicine. And she currently runs and operates a healing center in Mexico called the Healing Sanctuary. So without further ado, it's my absolute pleasure to introduce my friend and Dr. Pamela Smith. Pam, can you unmute your... Pam, I see you there.
I see you. I'm here. I'm here.
Oh, great. Wonderful. Hey,
Okay.
Pam.
Hi, how are y'all doing? That was really incredible what she said about her experiences with Kick It. I actually have never even tried that patch yet, so it was incredible what she said. But I'm glad everyone's here today, and I'm going to talk about the science of the patch, and I'm going to take it from a standpoint that you might not have looked at it yet. Meaning, a good mentor of mine told me a long time, keep it simple, stupid. So if you want to be a great speaker, one thing he taught me is you've got to keep your message simple where everyone understands. So even though the technology concerning the patches is actually quite complicated, I really took it back to its quantum physics healing. And it's more like what I am doing here. It's just, I compare it to my on-demand machine from Germany, and we place the devices on people's bodies, and then we put the frequency through the different parts of the body, and guess what? The frequency is traveling on the ionic channels, just like the patch. to the brain to send the healing signal for the body to heal itself. And I can make a correlation in quantum physics, medicine. There's a direct correlation. Now you're taking the technology of the devices we're using, and it's in a patch now. And I don't think anyone's thought about that yet, that the quantum physics connection. So then you talk about, okay, you put the frequency, the patch has a frequency, and that frequency goes into the ionic channel. And then you say, well, how does it move? Well, actually, it's electrically charged. That's how it moves to the brain and gets there quickly. It's the ionic electrical charge that makes the message travel to the brain quickly. And it's constantly talking all the time. So the skin is the largest absorption organ in the body. It's the largest communicator in the body as well. But we don't think of it like that. But with all these devices where I'm sending frequency into the body, it's the same thing as a patch. And when I was sitting down thinking about how am I going to explain the science, I love the idea that the devices here that I have, that I use on patients, are now in the patch. And that's totally amazing that you've made it simple, non-invasive, where a person doesn't really have to come and get a treatment. For certain things, we can use the patch. And I mean, I just made this correlation recently when I was thinking about what I was going to say, and you wanted to talk about the science. And the science really is, how does it work? That's what a layperson wants to know. How's this working? How do I explain it to other people? And that's what it is. The frequency or the imprint from the patch goes into the ionic channels. The channels move it to the brain through electricity, and it rewires or it retrains the brain with a new message. And the body heals itself. So the patch doesn't heal you. The machine doesn't heal you. It's your own body heals itself. When it has the right message and the right codes, it will heal itself. The body is an incredible healing machine. It's an electrical machine. And that's why everything travels through electricity, communicates through electricity. And I don't think many people understand that you're an electrical being before you're a human being. That really everything that transpires in your body is done through electricity. So I love the patch just because I've been applying it in several different, I have a wide range of patients here with many, many different kinds of diagnosis. Usually chronic, or they have cancer, or they have Lyme's disease. They have things that the Western medicine cannot heal. So when they're here for a little while, I can do what I can do. But when they go home, because they're here for short periods, I'm sending them home with the patches now, so that they have continued care through the patches. And we're learning and understanding the patches. So I love the patches, and I absolutely am convinced it's the wave of the future for medicine. And yes, we are learning, but I can assure you that the patch technology is here to stay and will provide a very wonderful avenue for many practitioners around the world. So that's my message for today, and I hope it made it a little bit clear and a little bit of simple to explain it to the layperson when you're trying to sell them or get them into the super patch. You've got to be able to quickly explain how the patches work. So I hope that I provided that for you today.
Absolutely. Thank you so much, Pam. That was amazing. Appreciate
Thank
it.
you. Thank you.
All right.
Pam, I have one question for you. Your practice is in Mexico, in Huatulco, I think.
Correct. Huatulco, Mexico.
And so as a doctor, you're originally from America, are you not?
Yes, Dallas, Texas.
Dallas, Texas. Okay, great. And so what made you move your practice or move to the area of Mexico to do practice? I'm curious as to why you moved to Mexico.
Right. Because of medical freedom, because in the state of Texas, they made 100 grams of vitamin C IV illegal in the state of Texas. They made B17 illegal in the United States. They made methyl blue fundamentally illegal. I mean, you still can order it, but it's very difficult. I mean, if someone risks their license to give you a methyl blue IV, the IV is going to cost $1,500 now, and they could potentially lose their license for giving you a methyl blue IV. So all the things that I was treating and using to heal the cancer patients and to heal the chronically sick, they took away from me legally. So I was harassed by
Uh-oh.
I think she
the
froze.
to
There she
give
is.
the shot. So it became so unbearable. I was in court every year fighting with the American Medical Association in Texas. So I have medical freedom here. Everything that I do here is absolutely legal. I picked Huatuco because it's an unknown place, but it's absolutely gorgeous. 32 beaches here, 7 bays. We have mountains, we have ocean. I mean, I wanted to be in a beautiful place and I wanted to simplify my life. So now I walk to work and I'm just across the street from where the clinic is. I'm 5 minutes from the beach. So the quality of my life has improved dramatically by moving to Mexico.
Wow, I had the good fortune of going to Huatuco as well.
Really?
An all-inclusive place in Huatuco, and it's very rugged but very beautiful.
Right.
Different certainly than the other side, but just as spectacular. And I have to ask you, I guess the reason you share the technology and wear it yourself and use it is because it gives you that medical freedom,
Right.
right? With no
Right.
contraindications and so on. So just briefly, tell us a little bit about the success that you've had with the technology yourself and some of your patients, maybe just quickly.
Well, I had back surgery 72 days ago, and I'm wearing like 5 patches right now. And number one, it really takes the edge off of the pain and is able for me to reduce the amount of meds that I'm taking for pain. And that's a big deal to me right now.
Sure.
The Liberty patch has helped me tremendously with having better coordination, regaining my coordination, because I was paralyzed and I couldn't walk before the surgery. So it was a very serious back surgery with, 5 fractured vertebrae and a lot of trauma from an 18-wheeler driving me into a ditch. And so I'm lucky to be alive, and really I'm lucky to be walking again. And I think I give the patch a lot of credit for giving me the mobility. And now I'm starting to wear the joy so that I can, really, I'm going to be walking soon, and it's making me have more positive thoughts that, I'm not going to be stuck in this wheelchair forever. I'm going to be walking soon, and I will be walking soon. And I think the patches have helped me a lot personally. Now, I have quite a few patients that the first time they used it, it really dropped their pain tremendously. And then the second time it didn't. So I don't know what that is. And the third time it did. I don't know what's up with that, where it's inconsistent like that. But she's 88 years old and she has a hip replacement. And, she got really good response from the Liberty, her coordination and walking, and also the pain patch. And
Right.
I mean, someone who's 88 that's got a prosthesis that's the wrong size in her hip, where she's in constant excruciating pain because the prosthesis is the wrong size. They did it in California. And, I mean, does she go back and change it? She doesn't want to. So we're trying to manage the pain through the patches and not drugs. So right now we have her on no pain meds. She's strictly on patches only. And she was on serious pain meds. So that is a big change in a month. I took her
Yeah,
through,
absolutely.
yeah,
Yeah. And
yeah,
I think the thing is everybody's um, body is different. We respond
correct,
to different things each day sometimes, I know we
correct,
wake up feeling perfect every day. And so, how we deal with that. I know that I talk to people a lot of times that they go to the gym and they have a great workout, and then they go to the gym and they say, my workout was terrible. So we're on different each day. So I think with the consistency of wearing it, this patient will be very, very happy at her ability to manage her pain. So thank you so much.
You're welcome.
Okay, Ricky, I think Nicole's going to introduce our next speaker, possibly.
Yes. Hi, everybody. Oh my goodness, that was such fabulous information, Dr. Smith. I took notes and I love what you said. When it has the right message and the right code, the body heals itself. I think that's so important for us to just really realize we're electrical beings before we're human beings. I love that too. I'm gonna take that. So I have the pleasure today of introducing a dear friend of mine, Dr. Kim Caparelli. She has, again, a very extensive resume, so I shortened it down and I hope I got all the good stuff in here. So Dr. Kim, she's a doctor of acupuncture and Chinese medicine with over 20 years of experience. She seamlessly blends Eastern and Western philosophies to help her patients achieve optimal health. She specializes in acupuncture, functional medicine, homeopathy, mind-body therapies, and wearable wellness devices. As a practitioner, speaker, author, and mentor, she stays at the forefront of holistic healthcare, integrating ancient wisdom with modern science to promote healing and vitality. She's been using the patches for a couple of months in her practice, and she's got some really fabulous stories to share with us. So, Dr. Kim, I'm excited if you can unmute yourself.
Oh, thank you, Nicole. Hi, I was listening to everyone else speak, the other physicians and healers, and I thought, oh my gosh, I was going to say that. Oh my gosh, I was going to say that. So I just wanted to tell you that in the last 2 months, since I've had these patches in my grips, I have seen some amazing, amazing things happen. Like a rib, fracture her back, and I have a text message that says, oh my gosh, what are in these patches? And I want to sell these patches. I want to, and I said, you're going to be my infomercial, or you're going to be my poster child. But she was so excited, and each and every time I get more and more excited about these patches. But we can talk about neuroplasticity and we can talk about balance. One of my big things is the vagus nerve. But Terry and I were talking before this call about touch therapy. And so I had said just the other day, this patch is like a hug. It is triggering, neuroplasticity. There's aspects of it like reorganization and adaptation and recovery and learning, the brain can acquire new skills and memories. But we all need a hug, right? And it's a touch therapy because it has the little ridges and it actually triggers the brain to go back into balance. Just like the medicine that I practice in acupuncture, I always thought that it was beyond the needle. And that is indeed the name of my business, Beyond the Needle. And it wasn't the needle, it was a touch. It was the aspect of me touching them, of my voice, of, my care. And now I've got these patches that have nothing in them and no drugs, no herbs. They are just the bomb. And here I can put one on a patient and say, let's try this. And before they walk out of my office, and it means that they didn't have acupuncture that day, before they even walk out, they turn around, they said, what's in these patches? Oh my gosh, I want more. And that has been every day that I'm in the office. It happens every day. It happened, I went to my nail place and I was getting my nails done. And I ran into a patient I hadn't seen for 15 years. She was shaking. And I said, I have a patch for that. And that's all I said. And she was all on it, along with 2 other women that were in the same area that said, do you have a card? Do you have a patch? And so right there, that's how quickly the people react to these patches. So I can't tell you enough how wonderful these patches are, obviously, but I can't tell you enough of what the science does and what the touch therapy does and what the rewiring and balancing of the brain does with these patches. And I was really happy to hear from Melissa about the Kick It, because I didn't think of that. And now, and that's why these Zooms are so important, because we could all learn from each other, right? And even from the people that are non-practitioners here, they're just listening to us. They can get something. I think I saw in the conversations, like, oh my gosh, I never thought about Kick It being like that. But now it puts a whole new spin on the pediatric patients that I treat also. So anyway, I just think that these are just amazing things. I love them. I'm excited about them. This is just my second month, and my whole counter, my kitchen counter, is full of packets of patches. And then I look and they're gone, and I'm like, oh my gosh, I'm gonna have to reorder again. And so I sell them in my practice. I send people to my website. It's just great. It's the best company I have ever even encountered. So that's
Thank
me.
you so much. No, that's so amazing. I love, I think even from a normal person standpoint, which, you know, I was a holistic practitioner in the past. And one of the reasons I transitioned out of that work is that it is a lot of work, right? All of you guys are sharing in that what you pour into your patients, like it is, it's a lot of work, both physically and energetically. I have 8 children as well. And so the reason I did that is to be able to help people. What I love now about what I do is that I'm able to help a huge amount of people, and I don't have to be a practitioner at all. So what these calls are amazing for is that you guys hear all the time from us being these normal people. We're just sharing with our friends and family, and we have this major validation coming in from these brilliant and incredible women showing we are also using these, right, to share with the people that we love and in our practice. And we're choosing this first a lot of times versus it being a backup, or we're choosing this as a first option in really effective treatment because it's only going to help. And I just love this. I've taken a lot of notes today too on my phone, and I'm so grateful for you guys. Terry, do you want to hop on and introduce our next? I would have loved to introduce you, brilliant Dr. Toker, because I'm kind of in love with you. But Terry has all of your information, so I'm going to let him. But we are really excited to hear from you and super honored that you would take time out of your day, just like these other 3 ladies did.
Nice to meet you.
Yes,
Thank you very much.
it is my honor to introduce Dr. Anna for sure. It's she's an incredible lady. I've had the good pleasure of meeting Dr. Anna at a number of our events. She has spoken at a number of our events, and I've just gotten to know her as a person, not only as a professional colorectal surgeon, but as a human being. And, you know, Dr. Anna is an award-winning and renowned board-certified colorectal surgeon in the Dallas area and has been there for nearly 20 years. And because Dr. Anna has a unique ability to translate complex concepts into everyday language, patients from all over the world and from all over the country seek both her surgical skills and her nutritional advice. In the last 5 years, she's expanded her counseling to include nutrition for optimizing post-operative healing, weight management, and improving gut health and the microbiome. She is an integral part of the medical advisory board for the Super Patch Company and is a personal user and sharer of our incredible VTT Vibral tactile technology. And what I will say is she is funny as heck too. She's a scream, and we have a lot of fun together. So it's my great pleasure to introduce my friend, Dr. Anna Toker.
Oh, you're making me blush, Terry. I'm just saying. Excuse the light. The lighting in this room is absolutely terrible. I'm still at work, and I apologize for that. But thanks for inviting me. And I don't necessarily have anything prepared per se, but I'm going to build on what the other physicians were talking about. And as Terry was saying, I've given some lectures to the national conventions now, I guess 3 times, 3 different lectures. And the last one that I gave actually hits on what Dr. Smith, our Watuco doctor, is talking. And Watuco is beautiful, by the way, if you've never been. It is gorgeous. But anyway, where these devices are considered physical therapy devices. So they're class 1 physical therapy devices. They fall into the same category as a Band-Aid or an ACE wrap or a crutch. And what that means is that, number one, they are registered with the FDA, but they will never be approved by the FDA because the FDA does not need to approve a class 1 medical device. That's a critical piece of information because a lot of people, especially the competitors, are like, well, you're not FDA accredited. They're never going to approve it. The FDA does not approve Band-Aids. So it is registered with the FDA. And the reason it is registered with the FDA is so that we can do IRB approved human clinical trials. You cannot do a human clinical trial with a physical device without it being registered with the FDA. So that is why so much effort was taken to register these devices. They're considered physical therapy. They're not considered medicine, which is why they don't need a prescription. And it is also the angle that the company is trying to make with insurance companies to get them approved in the same way that we approve ACE wraps and crutches and whatnot for insurance copays. You can bill as a physician or a physical therapist. I see someone just texted in their physical therapist. All the same codes you use for physical therapy taping with like K-tape, those are the exact same codes that you would bill insurance when using a super patch. So an office visit plus a 97110 and GO2A3, those are all physical therapy codes that for topically applied physical therapy. So if you're a practitioner that works with insurance, that is an important piece of information. If you're talking to someone who sells a competitive patch and they give you some yammerings about well, you're not FDA approved, it's not going to be, there's no point, and that's not required. Okay, so just to kind of clarify the FDA thing. The physical therapy aspect of it does explain what these other practitioners are talking about when they talk about the healing touch and the interaction of the human body with these technologies. They use, I'm sorry, my phone's going off. They use your body will use sensation in your skin to translate a physical interaction into an electric signal, which travels up a sensory nerve, goes through the posterior aspect of the spinal cord, that hits the central part of your brain. And depending on which patch it is that you're using, that signal will either propagate forward towards, let's say, the pineal gland hypothalamus for sleep, or let's say slightly backwards to the cerebellum. This is going to help our athletic ability and our balance. If it stays sort of central, now you're talking about helping with ruminating thoughts, your focus, so your immune response, your blood sugar level, your hormone level. So all the things that you can address with these patches are done through basically the same channels, and the intensity of perforation through the brain with that signal depends on the patch pattern. Now, I try to explain to patients, because there's no medicine in it, so there's no contraindication to using them, that this is very similar to any type of biofeedback mechanism. So imagine, you've got pain, and, we'll use these biofeedback devices where your iPhone has one, where you stare at the little thing and you're supposed to slow down your breath, and that slows down your pulse. When you slow down your breath and you slow down your pulse, you're putting your body into a parasympathetic predominant state. That's your rest and digest state. This is the state in which we sleep, we heal. We are not anxious in that state. We have less pain in that state. We're less ruminative in that state. in the modern world, we spend a lot of our time in the fight or flight state. And so a lot of us will have symptoms that are driven by the sympathetic nervous system because of modern life. And so biofeedback pulls you out of that. Oopsie, pulls you out of that and puts you in the parasympathetic state. So these patches, unlike proactive biofeedback, where you have to like watch something to watch your pulse go down, you actually don't have to pay attention to it at all, which is what makes it the perfect sleep biofeedback device. It's portable, it is not expensive at all, and it is also something a lot of people kind of understand because they've probably used it to meditate before they sleep or to calm down their anxiety, and breathing in a paper bag, all those things. Your patients know what that is, so that's a very easy thing to say to people. And more importantly, when you do the EEG, that is exactly what you see. So if you're talking to someone who is a scientific skeptic and you hear things about energy and electricity, I have to be honest with you, the average scientist will now have skepticism. And there's no point in being skeptic. I am telling you, the science here works. The way it works is by utilizing your parasympathetic nervous system, by keeping this parasympathetic nervous system in homeostasis. So these patches are just biofeedback devices. They act like a touchstone, no different than you closing your eyes and walking down the hall by feeling the wall. That's what kind of keeps you going in the right direction. This is the same concept that these patches are doing for your brain, for lack of better words. Okay. So that's an easy way to explain it to people. In my own personal practice, I do use these devices before and after surgery because they help calm people out of the stress response. And there's nothing more damaging to surgery than a patient who is under stress. And so if you give those patients a peace patch, a liberty patch, and a freedom patch, that person has a lot less of that sympathetic tone. Their pain is controlled, their anxiety is controlled. If they're struggling sleeping, you can give them a REM patch. All of those things, because there's no medicines in them, have no side effects. They're not going to alter someone's mentation. They're not going to complicate the surgery. They're not going to cause constipation or bowel habit changes or nausea, vomiting. And so for the postoperative period, as part of what I call the enhanced recovery after surgery, these patches become pretty critical in my practice. And then, of course, personally, I use them. I met Jay completely by accident on a online TV show where I was going to talk to Mark McDonald, who's now a spokesperson for Super Patch, about gut health. And then I see Jay, some dude, talking. And while he is speaking, because he's saying stuff that I know to be true, right? I'm like, oh, what? That's crazy. I had ordered $300 worth of patches before that guy finished his 10-minute speech. And then before I could go on, like when you're in kind of like that hold while the commercial break is on, I start picking his brain. I'm like, who the hell are you? What did you just say? Why did you just say it that way? That's fucking amazing. And now I'm going to have a conversation with you. So after that meeting, he and I spent 2 or 3 hours on the phone, just sort of discussing his technology. Ultimately, I was invited onto the medical advisory board, and currently I'm in the process of doing a human trial study on balance using the Liberty Patch for patients to try to prevent falls in a hospitalized setting, which shockingly, 10,000 people a year will die as a result of a fall in the hospital setting. And for less than $2 a day, you might be able to save. Even if you only save 10% of those lives, you've saved 1,000 people. So that's the kind of research that we are doing. And then I had a brief collab with the University of Arizona on a microbiome test that they're doing using Liberty and Peace, which I think that's going to pan out properly. We'll see. It'll be interesting. And then there's which will be important for you guys as affiliates and associates and salespeople and whatnot. The more you can have in the published scientific literature, the better. So yes, we will get our balance study published, but we are going to do A feasibility paper, it's basically a review paper that solidifies this concept of non-participatory biofeedback using the literature that we currently have on EEG evaluations of patients after meditation and other forms of biofeedback, correlating to that to what we already see with Superpatch, and thereby getting sort of a secondary claim, so to speak. You don't have to reinvent the wheel. You just need to show that your results are the same through a similar test. So we'll be publishing that, hopefully that this year. We're in the process of writing that. And I will say one more thing, Terry, before I stop hogging all the air. When you guys, I haven't broached this with Jay yet, but I think it's important. The one thing that will get people into trouble quicker than anything is a statement of claims that are outside what you have shown to be a claimed fact. So when we have something published, you can make that claim all day long. But what we don't have, and we have published for symptoms. We have symptoms published, like you can't sleep. That's a symptom. You have pain. That is a symptom. You have lack of balance. That is a symptom. What we don't have are claims for disease. So if someone says, I have diabetic, whatever, you're not treating diabetic anything. But if you have pain, I have a patch here that may work. Just know if you're treating that kind of pain, these patches need to be on a piece of skin that still has sensation. And diabetics and people with vascular disease have pain in places where they have no sensation. So be cautious in those patients not to put these patches on the area that hurts in someone with peripheral neuropathy. That won't work. You'll have to slide it up higher to where they have sensation. Put the patch someplace where they have sensation, and you're not treating their diabetes. You're not improving the blood flow to the foot. All you're doing is correcting a parasympathetic pathway that causes that pain to be amplified with those phantom pains, if that makes sense.
So actually, I would love for you to say, okay, this was really huge what you said when you were talking about post-surgically. One of the reasons you use liberty, peace, and freedom, and not just freedom, is because stress heightens pain. I think that was really, really huge. And
Yes.
I would love to, I mean, I see that in my kids, right? They
Yes.
hurt themselves and they're shrieking and freaking out. You know, the first thing I put on them is peace, actually. And then most their pain goes away, right? But that was so huge that I think people really need to hear that. And I mean, like, that was so good of you saying one of the reasons you're doing this is so they can heal afterwards themselves, so they can calm.
Correct. So the number one, most of us live in a world of hypersympathetic tone. And so our bodies are designed for protective purposes to be in that way. But a lot of stuff in the modern world, we get all ramped up in anxiety about for literally no reason. You're not dying. No one is well, none of us are dying. None of us are being shot at currently. So when the door slams, do you really need to freak out and turn into a jumbled mess? No, you actually don't. But if you're that type of person who's on edge, you are on edge because of hypersympathetic tone. And so the peace patch just brings down that sympathetic tone and brings up the parasympathetic tone to get you more into a balanced state. When you're in a sympathetic tone, your gut does not work properly. Your cortisol is elevated. You have elevated blood sugar, and now you don't heal properly. So from a surgeon's standpoint, if I want to heal a wound, and I do intestinal surgery, right? So I need my gut functioning properly, and I need to have normal blood sugar, and overall I need to have a calming of the sympathetic pathways. If you wanted to, in theory, you can add the Lumi patch to help with epithelial healing. So I have not really done that, but if you had someone who was struggling with Crohn's disease or some other intestinal colitis, that's not a bad add if you're doing liberty and peace and it's not kind of cutting it. But anyway, so in my practice, I try to keep them out of sympathetic tone if I can help it. So that's how I use it.
So good. Thank you so much. All of
Sure.
that. Amazing.
Yeah, and I think the amazing thing, Dr. Anna, is seeing the people that are already utilizing something else to work on their health or their physical fitness or whatever, and how these patches, this technology enhances what they're already doing and allows the body to uptake what they're doing already. And from the perspective of Dr. Caparel that said, whether it's acupuncture or whatever, that we're hearing stories that the body's uptaking the treatments better and faster.
Yes. Yeah, it's life enhanced, right? And again, when your body is in that restful state, that is when you absorb the most knowledge. It's when kids grow. It's when you heal, right? So someone who is in the need to study for a test or sleep or little kids growing or you just had surgery, we don't put them in the middle of, a stressful situation firing squad because they'll never heal like that. This is innate knowledge that everyone knows. So if you can get your body into a restful state, then you, by definition, are going to be able to maximize your potential in almost anything that you endeavor in. And this is why people meditate. It's why they listen to classical music. It's why they may do infrared, and it's probably, this is why they're doing massages and acupuncture and all those holistic healing things. This is why they're doing that. And so these patches are allowing you to achieve that parasympathetic state. It's just extraordinarily targeted, depending on the pattern, will hit different states. Now, I'm sure because they all have to travel up the back of the spinal cord and go from thalamus forward or thalamus backwards, you're getting some of overlap with some of these patches. You're going to get some overlap. So like somebody who is stressed, peace patch is good, but if they have a lot of that rumination, yes, kick it because it goes out just a smidge laterally to the amygdala. So if you know neuroanatomy, and I know a lot of you guys don't, but I'm just saying each of those patterns is target specific, not to a disease, not to a body part, but to like a neurologic pathway. So it's a neurologic body part, not a peripheral body part. And if you can get that into its rest mode, then everything it controls will go into normal rest mode. And for as long as that patch is communicating with your brain, so it's like a biofeedback loop is on. It's like a light switch. And the second you take it off, light switch off, you have not cured a single disease. All you've done is put that patient in a restful state in that particular neurologic pathway that allows that symptom to go away. We've not done an official placebo-controlled trial to see if you can get a brain to automatically reset to that baseline point, right? So the brain, if it's constantly out of whack, will just give up. It'll just go to the out of whackness. And I referred to that paper at the last meeting that we went to. It's a long and complicated paper, but the point of the paper was if you're out of whack for a long enough period of time, your brain will compensate to the out of whack level. Corollary, if you can calm that down, you should be able to get the thing to go back to a normal level. So that is a study that's worth endeavoring. We just haven't done it yet, so you cannot make that claim. That's all I'm going to say. You cannot say eventually you've healed and you'll never need this patch again. While I think that's going to be a true statement, that's a claim we cannot make, only because that study has not yet been done. It will be. You just got to give that one's probably going to be a several-year trial, so you just got to give it time.
Yeah, I mean, we're a toddler as a company.
Toddler. Oh my gosh.
Toddler.
Yes. Yeah.
And
yeah.
we know toddlers, they need peace and focus patches. So toddler as a company, so we got to work with them as well. But funny story, you talk about the freedom, the liberty, and the peace patch. A year ago, June, I had a surgery done. And of course, everybody, gets nervous when they're going into a surgery. And of course, when they gowned me up, they saw 5 or 6 patches on me, and of course, it stopped everybody like a deer in the headlights. And they're like, the doctor's like in his deep voice, not his normal voice. What are these?
Yes.
And I'm like, well, these are a drug-free patch that I wear, and I need to keep them on during the surgery, and I need to keep them on. And I'm going to tell you, if you ask me to take them off right now, I will walk out of this anesthetic room. And if they're not on when I wake up, you're not going to want to know me. And so, sure enough, when I woke up from the surgery, Anna, they were all on in place. And I was calm as could be, and I had absolutely no pain whatsoever. And they almost pushed them into the recovery room to say, "Hey, you need to take these pain pills." And I'm like, "Well, no, I don't. I don't drink if I'm not thirsty."
Yeah, exactly.
So it really is true, and I think they will become a protocol in time for pre and post-op surgery for sure. So,
it will. I mean, I've already got a protocol. It's just a matter of recruiting patients for the study, one thing at a time. Back off, Terry. One thing at a time. Do you understand what I'm saying?
Okay, take it easy. Hey.
Take it easy,
dude. So, anyways, Ricky, another phenomenal call. Carolyn, Nicole, what a great lineup we had with Melissa, Dr. Pam, Kim, and of course Anna Toker. What a lineup! That's like an all-star lineup right there, if I've ever seen it. So, great call, Ricky. Take us home.
Yeah, we are so grateful to you guys. Thank you so much for being here. Each one of you, what you shared, we'll have this recorded for anybody that wants to go back and watch it again. And yeah, we're planning on doing these monthly. And once again, thank you guys so very much for taking time out of your day and away from your patients. We're very grateful for that. And we'll see you guys next time.
See you guys.
Thank
Thanks
you.
very much.
Thanks, everyone.